Our grief journey continues. I recently completed what I called 45 days of grief. Go back and watch some of those videos I went through. I was personally going through my own grief as I was studying grief theories. And now I'm sharing in this continued grief journey what I learned about grief and how to actually process intense grief. My name's Christy Bunda-Kamara. I'm a psychiatric nurse practitioner, but unfortunately, I am an expert in grief. I have lost 3 children over the course of 17 years, most recent just over a year ago. As I was going through this 45 days of grief, it started off with kind of what I expected. I had, periods of controlled grief, lots of crying, and, really what you would expect in trying to process grief. Day 7, I hit this anger wall that was so intense. And as a psychiatric nurse practitioner, a specialist in cognitive behavioral therapy, I have always known that anger is a secondary emotion, right? But this anger was so intense. I have never been so angry in my life. And this is why I think it's important if you decide to go on this grief journey and you are dealing with intense grief, that you do it every day for a period of time, because it was because I was pushing through this pain every day that I got to this, that this anger just came out in full force. And I did some techniques to skills to deal with anger, which, things like punching a punching bag, burning paper, like there's ways to process anger and try to get to the bottom of it. But when I was meditating on this anger, and a lot of grief theories talk about anger, a lot of people who have experienced intense grief have anger. And so this is not a new thought or emotion to grief. And as I was meditating on it, I was trying to picture or figure out, what is this anger and how do we actually deal with it, right? Because many of my friends, colleagues, even professional colleagues, I have, therapists that tell me, I don't know what I would do if I've lost my children. I would kill myself. I would kill somebody else. Like, that is anger. And everybody understands that having lost a child, I kind of have a right to be angry. But it wasn't helping me. And so as I'm meditating on what is this anger, I envisioned like this protective force field around my body, and the pain feels so unbearable that you have to put something in front of it. And so that anger is a protective to myself. It's protecting myself. And you'll notice in the descriptions, we have a link to a choice opportunity that I developed based on this. And just looking at that picture of the force field around you, and what are you putting in place to protect yourself in order to not feel this pain, or try not to feel the pain, or maybe not allow other people to feel the pain. For me, at this moment, it came up as intense anger. Many people tell me I don't experience anger. Maybe experience depression. And one of Freud's theories that I actually think is very true is that he says that depression is anger turned inward. And so whether you want to call it anger, depression, withdrawal, what are you doing to protect yourself that's actually holding you back from healing? And I'm not saying we can strip these layers away. Like, you're not going to just, say, oh, I'm not going to be angry and take this protective layer away. But you can begin to disable it. And the first step in disabling this protective layer is acknowledging the anger, acknowledging what you're protecting yourself from. And for me, it's the pain. And I think that's what many of us are doing, is we are trying to protect ourselves from the pain. We feel the pain, but if we actually let ourselves really feel the pain, we might not be able to bear it. And I think that's what we're afraid of. We're afraid that we won't be able to bear it. It often feels unbearable without really, taking away those protective measures. So the first step is just acknowledging it and making a choice to try to disable it. Again, you might need to be in a better place of self-healing before you can, really take away that protective layer, but don't build on it. And I often see this with people who have intense grief. They'll tell me, 5 years ago, my child died. 10 years ago, my child died. And the layer, that external protective layer, is getting thicker rather than trying to disable it. So the step today is just to acknowledge it and then choose to be aware of it and try to disable it. It's not a easy decision. I talk about in the last video of controlled grief. It's a lot of time, and it's not easy, and it's not a cure. But if we can acknowledge that this anger is protection for the pain that we are feeling, we can begin to disable it over time. And I can tell you that was, several weeks ago, probably close to 4 to 6 weeks ago, was the beginning of my 45 days of grief. And I've had 2 major episodes, I would call them, of this intense anger and, inappropriately fighting with my husband. Like, I am not perfect. I know we're all doing some of these things that we're not proud of behind closed doors. But acknowledging that this anger is a protection for our pain so that we can begin to disable it. We do have a right to be angry. However, we're only hurting ourselves by not acknowledging it and trying to work through that. And I will continue to talk about those things in the next video. It'll be, about how to separate those things and how to self-regulate. But I'm taking you along this journey. And if you do this day to day, your journey will be slightly different, or maybe a lot different. Because your layers, what's coming up for you may be very different. But I challenge you to actually make those choices to work through these things. And so for me, I started my 45 days of grief with, kind of an expectation and knowing this controlled grief process. And then this anger hit me. And I had to take a step back or pause and try to really figure out what this is and how do I work through this. It's not over. I'm still angry. I'm angry with myself. I'm angry with God. I'm angry with how difficult life is. I'm angry with my husband. I'm still angry. And so that protective layer is still there, but it's a little softer. And so instead of, as time goes on, your protective layer getting harder and harder, I challenge you to make it softer, and you're more aware, and you're trying to release those things. This is a very, very difficult journey, but I believe that we can find purpose in our life, and I believe that we can find our mental strength. I believe that you are mentally strong.